Hello everyone. So I hope all of you all are doing good. I just want to be, is my audio visual clear? Hello everyone. So I hope all of you all are doing good. Yes? Could somebody please comment in the chat box if the audio is clear, the video is clear? Yes, okay. So I know you all are in the peak of your preparation right now. So let's have a very quick discussion on the various image-based topics which are important, especially in orthodontics. You get a lot of image-based questions from ortho, right? So without wasting much time of yours, let's quickly move into the session. So let's have a quick interaction to see how much you all recollect at this point of time. If you all don't recollect, it's okay, it's fine. You all can go back and refer to the images, okay? Right. So moving to the first image, quickly put up in the chat box what the image is. So do you all know what this image is? Yes, very simple one. It's a distalization appliance. Very good, very good. It's a Hilger's pendulum appliance. So can you all tell me what the use of this appliance is? So like I mentioned already, it's a distalization appliance. Okay, so you can see here in the image, you can see over here, right? You can see there is a acrylic button over there, right? So they use a large Nance button in the palate to take up support. Okay, right. So that is a distalization appliance. So what is the force applied by a pendulum appliance? Any idea? It's approximately 200 to 250 gram. Okay, so that's a pendulum appliance. Right. Moving ahead. Do you all know what that modification is? Can you see a slight change from the pendulum appliance in the given image? What is that modification? Very good. Rifa has mentioned T-Rex. It's actually the Pendex. Okay, a modification of the pendulum appliance. So in the name only it's given. What is Pendex? It also helps in expansion of the arch, right? So that is about your Hilger's pendulum appliance. Moving ahead, again a distalization appliance. What is this appliance? Am I audible to all of you? Okay, so can you all tell me what this appliance is? Frog appliance. This is a fast back appliance. Okay, so it's a fast back appliance. So again, it's a distalization appliance. Okay, so you can see here it uses night-eye wires. Okay, and it helps in distalization of your upper molars. Right, Konali, right? It's a fast back appliance. Good. Moving ahead, again we have many other distalization appliance, so we'll just cover in the sequence. So can you all tell me what this appliance is which is shown in the image here? So I'm waiting for your answers. So I mentioned it's a distalization appliance. It's your Jones jig. Okay, so that picture that you see here is your Jones jig. Now the next picture that you see here, the picture you see down, that is your very good, Konali, good to go. It's a Jones jig, right? So yeah, what is that appliance that you see here? That's a sagittal appliance. So this sagittal appliance, yes, the screw that you see here, like Konali has mentioned, the screw that you see here, that's your jack screw itself. But that appliance you see, that is your sagittal appliance. Okay, so it's a removable device which incorporates jack screw. Okay, so you can see in this image, this appliance, how is the jack screw placed? It's placed parallel to your molars. Okay, right. The next appliance that you see here, another distalization appliance. Very good. That's your distal jet appliance. Okay, very good. So again, a distalization appliance, but it has one more advantage. Apart from distalization, it also helps in rotation of your molars. Okay, so the anchorage here is provided with the bicuspids, first molars, first premolars. Okay, right. So that is about your distalization appliance. Now, can you all tell me what kind of an appliance is this? Very good, very good. It's a Hyrax appliance. So, like most of us will be knowing, Hyrax is a rapid maxillary expander. Okay. So, what does Hyrax stand for? It stands for hygienic rapid expander. Okay. So, that is about your Hyrax. Some of you have mentioned Derishweiler. Now, let us be very clear about this topic. Okay, so we all know rapid maxillary expansion is very important. You get one or the other appliance in almost all your NEET exams, right? So we cannot go wrong in this, right? Okay, so the concept of RME was introduced by So there is a slight delay in the streaming and the comments. That's why it's taking the pauses. Okay, right. Okay, so am I still audible to you all? Is the video clear? So we were talking about the father of RME, right? Okay, so yeah, so the father of RME, if yeah, so the father of RME is Emerson Angle. Okay, so RME is rapid maxillary expansion. So we need to know certain things on rapid maxillary expansion. So the first thing that you need to know is the rate of expansion. Your rapid maxillary expanders provide 0.2 to 0.5 mm of expansion per day. Okay, and the amount of force they provide is around 10 to 20 pounds. Okay. Okay, so moving ahead, we have two types of RMEs, rapid maxillary expanders, right? So we have tooth bone and tooth and tissue bone appliances, correct? So we need to be very clear on that. So how to identify in image based questions, right? So tooth bone appliances, tooth bone RMEs, be very clear, you will not see any acrylic plates in it. Okay, so if there are acrylic plates present, understand it's a tooth and tissue bone type of RME. So what you need to know is which are the tooth bone type of RMEs and which are the tooth and tissue bone type of RME. Okay, so the tooth bone type of RME is Isaacson and Hyrax. Okay, so this picture that you see here, so the first picture we have shown, that was Hyrax. Okay, so you see there is no acrylic plate over here, correct? So that's your Hyrax appliance. Now the next picture that you see, that is your Isaacson appliance. Again, there is no acrylic plate in Isaacson. Okay, so in Hyrax it used a screw called as your Hyrax screw, hygienic rapid expander screw. In Isaacson, it uses a screw called as your mini screw. It is the name is based upon the University of Minnesota. So MINNIE. So that's a screw used in Isaacson. So that is about your tooth bone type. Now you have tooth and tissue bone type. So this picture that you see here down, that is your Haas type of RME. Okay, so Haas is tooth and tissue bone type of RME, and the next image that you see, that is your Derishweiler type of RME. Okay, so we have Haas and Derishweiler. So how do you differentiate? So you see acrylic plates are there, so that means they are both tooth and tissue bone. Now how do you differentiate between your Haas and Derishweiler? So just focus on those wire tags in Derishweiler. So Derishweiler has those wire tags and Haas has those thick metal wire extension. Okay, so those tags are present in Derishweiler. The metal wire extensions are present in Haas. Okay, right. So that completes your RMEs, rapid maxillary expansion. So I hope any question comes on RME, you will not go wrong, right? Correct. Moving ahead. So that completes RME. Now moving ahead into your SME, that is your slow maxillary expansion, right? So looking at this image, can you all tell me which appliance is this? So you can see an omega shaped wire over here. So which is that appliance? Very good. It's the coffin spring. Okay, very good. So like I said, you see the omega shaped wire. So as soon as you see the omega shaped wire, you should be able to identify the coffin spring. So do you know the thickness the wire uses? It uses around 1.2 mm of thickness for the coffin spring. Okay, right. The free ends of the wire is embedded in acrylic. That is about your coffin spring. It provides slow maxillary expansion. Now talking about SME, slow maxillary expansion, again now there is a rate of activation. Okay, the expansion rate for your SME is 0.5 to 1 mm per week. Okay, so it's very slow compared to your RME. Okay, and the force provided by SME is 2 to 4 pounds. Okay, moving ahead. Can you all tell me, this is very simple, can you all tell me which appliance is this? So you can see in the image itself, you see there are 4 helices. Okay, very good. So that's a quad helix, as the image says and as the name suggests, it's the quad helix. Now what is the purpose of these helix? What's the purpose? So providing this helix increases the wire length. Correct? Increasing the wire length provides increase in the flexibility and range of action of the helix. So again, it provides slow maxillary expansion. Right. This appliance, sorry, I've put up the name already. So this is your Schwarz appliance. Again, slow expansion, but just the difference from the other appliances that this appliance can be used for distalization of your lower arch. I mean expansion of your lower arch, unlike the others. Correct? Everything else, whatever we discussed till now, was for the maxillary arch. Correct? So Schwarz appliance can be used for expansion of the lower arch. Okay. So the activation needs to be done only once in a week. So it provides 0.25 mm expansion. Right. Now, can you all tell me the, okay, again I've put up the name. Right. So this appliance that you see, again it helps in expansion of the maxillary arch, especially in cleft cases. Okay. So cleft palate cases, this appliance can be used. It provides a force of around 300 to 350 grams. Okay. So it uses night-eye wire. We know the advantage of the night-eye wire is that it provides very good flexibility. Okay. Now what are these? Those of you who have done ortho treatment by on themselves, they would know. What are these? Elastics, what exactly? Elastics are for what? Basically they are separators. Okay, they are separators, they are not ligatures, they are separators. Okay, so so those are your elastic separators. Now there are various other kind of separators. Can you all tell me any other separator that you all know? Basically, what is a separator? What is it used for? So it's used for placing between your teeth and providing or creating spaces between teeth interdentally. Correct? So that various orthodontic appliances can be placed in between. Right? Very good, Priya. There is something called as Kessling separator. So this image, focus on this image that I'm showing you all. That's a Kessling separator. So what is a Kessling separator? It is actually, the purpose is the same. Now what does it do? It provides, it is a metallic form of your elastic separator. Okay. Now comparing both the separators, Kessling separators are said to be more effective. Okay. Right. So that is about your separators. Now other than separators, right. Yeah, moving ahead, let's talk about the various pliers. Again, you get questions on orthodontic pliers very frequently. Okay, so you need to differentiate between, it all looks similar in one shot, correct, but you need to differentiate between them. So this image that I'm showing you all, any idea what this image is? Separators were those small rubber things that I showed. Kessling separator and elastic separators are separators. This is actually a plier that is used to place a separator. So they are called the separator pliers, okay, or the separating pliers. Okay, fine. So that is how they place the separator. So what exactly do these separating pliers do? So they basically, what they do is they expand the separators before placing them interdentally. So that is the use of your separating plier. Take a look at the plier very closely. Okay. Moving ahead. So this weird kind of instrument that you see, can you all name what the instrument is? So this instrument that you see, that is made up of high impact wood or plastic, okay, and it has a triangular tip over there with serrations. So what is the purpose of this type of instrument? Priya's mentioned band repositioner. Basically it's a band seater, okay, or yeah, band placer, band seater, correct. So yeah, the details have already mentioned. Fine. This image would be, you all would be familiar with this image. You all see this image quite often. This has been asked in one of your previous NEET exam. So can you all tell me the name of this instrument and also the purpose of this instrument? So you all see there are various markings. Very good. It's the Boon's gauge. So there are markings of 4, 4.5, 3.5 and 5. So what exactly is the purpose of those markings? What is it used for? So basically it is a bracket positioning device. So what does these 4, 4.5, 3.55 suggest is that they help in measuring the distance between your base of the bracket and the incisal aspect of your tooth. Okay, so that is your Boon's gauge. Another such device, do you all know the name of this device? Very similar use. You can see the measurements there, 3.54, 4.55, similar to Boon's gauge. But what is the name of this device? It's a bracket positioning device as well. Good to know that so many of you are answering it right. I know it's your peak time, correct? So I hope this will be a quick revision for you all, and you all will be able to recollect things for day after's exam. So again, it's a bracket positioning gauge I mentioned. It is called the height gauge. Okay, it's a heights gauge. Now tell me, this instrument that you see, do you all know the name and the purpose of this instrument? So you can see they have a rectangular tip with so many serrations. So what could be the correct. They help, Konali has mentioned it right, to push the band. So that rectangular striation that is seen, that is used to push the band and help transfer forces. So basically this is a band pusher. Okay, the name of this instrument is Mershon band pusher. Okay, so it helps in pushing the band and helps in their placement. Okay, right. So that is your Mershon band pusher. Okay. Now coming ahead into the various pliers. Can you all name this plier? Easy one. So you can see there are various striations here, correct, on the beak. Okay. So this plier which is there, it is used for bending of fine wire. So can you all name the plier? This is not the bird beak. It's actually the, anybody else? Yeah, it's the Geravax light wire plier. Okay, it's a Geravax plier. Okay, so again the purpose is to normal bending of your light wires, right? Fine. Another such plier. So you can see there are loops over here. I have given the clue myself. So what is this plier? So do you all know the name of this plier? So basically you can see with this kind of tip, what could be the purpose? To make loops. Okay, Konali, you're right. So this is the tweed loop plier. So it helps in making loops. Okay, so if there are multiple loops of the same size that has to be made, that can be made by using this type of wire. Okay, that is your tweed's loop forming plier. Another such plier, again you know by the design only that it is for making loops, correct? What is the name of this plier? So you can see there is a 4-step design for this, correct? So 4-step design is for making loops of different sizes, okay, multiple sizes. So do you all know this? Very good. It's a Nance loop forming plier. So the difference you need to know. This is tweed, okay, a bit more rounded and circular. The 4-step one is your Nance loop forming plier. Now, can you all tell me this? This question again you would have come across. It has been asked 1 or 2 times in the previous exam. Can you all tell me the name of this instrument? So you can see there is a Y-shaped tip for this instrument, correct? So Y-shaped tip. What is the purpose of that Y-shaped tip? With that only you should be able to name the plier. So do you all know the name? So this Y-shaped tip is used for twisting of your ligatures. Okay, correct. It is used for ligating. So what is the name? It is your Kuhn's ligature plier. Okay, or the Kuhn's ligator. Okay, this has been asked previously. So just focus on the design. Y-shaped tip, Kuhn's ligator. Okay, again this also you would see frequently this question coming up. This needle, okay, sorry, I mentioned the name by mistake. It's a needle holder, but can you all tell me the name of this needle holder? So you can see there are serrations on the tip to have a better grip of needles. But why is it discussed in ortho? It also helps in the grip of your ligatures or placement of your ligatures. Okay, so the name of this needle holder is Matthew. Very good. So it's a Matthew's needle holder. Okay, now this plier that you see here, can you all name that plier? So again, this plier, basically they are of two types of design. Okay, so for the anterior region it is of a flat design, and the posterior region it provides a 60-degree angulation. Do you all know the name of this plier? So there is a straight one and an angulated one. So basically, what is the purpose of this plier? What is it used for? So this is a bracket removing plier. Okay, so the tip of these pliers, they wedge between the tooth edges and the base of the bracket. So when they wedge between the tooth edge and the base of the bracket, it helps in easily displacing the bracket. Okay, so it is basically your sorry, bracket removing plier. Okay. Okay, so that was about your most important pliers. Now, can you all name this appliance, this orthopedic appliance that you see here? So, the other appliances, your various removable appliances have not included in this because those are very familiar to you all. You all would have done those wire bendings, your Adams and labial bows and all have not included. Okay, so moving ahead into the orthopedic appliances, there are chances that you get confused with the different types of them, so I thought I'll include that as well. Okay, so what is this appliance? And in who are these appliances used? Very good, it's the headgear, correct. So it's again, there are different types of headgear. So this picture that you see here, that is your cervical headgear. Why cervical? Because it uses the nape of the neck to provide the anchorage. Okay, so what is the purpose of your headgear? So basically, these are for patients with excessive horizontal growth compared to the vertical growth, and also for patients who have slightly protruded maxilla. Okay, right. So that is your cervical headgear. Now this picture that you see here, that is the other type of headgear, that's your occipital headgear. You have a combination of cervical and occipital as well, so you need to focus on the picture. Okay, I've not put a picture on that, but you need to focus on the picture and identify which type of headgear is it. So occipital uses the anchorage from the occipital bone. Okay, right. Moving ahead, this is what is this type of appliance called? So again, this is an orthopedic appliance. So this appliance, basically you can see there is a chin cup below in the chin, right? So this appliance is actually a face mask, okay, which is also called as your reverse pull headgear. So understand one thing, reverse pull headgear and your face mask is the same. Okay, now there are various types of face mask. You have something called as Delaire face mask, Petit face mask, Tubinger face mask. Okay, so this face mask that you see here, that is your, very good, it's a Delaire face mask. Now how do you differentiate it from the Petit face mask? Oh, what is the use of a face mask, by the way? So basically, we know it's a reverse pull headgear, right? And you see the chin cup as well. So in class 3 cases where there is protruded mandible, in those cases you can go ahead with a face mask. So these kind of appliances, we all know it is given in the mixed dentation phase, right? Very good, Priya, very good. So Priya has mentioned the difference between the Delaire and the Petit face mask. So I've put a picture so that it's clear for you all. The squarish shaped one, the squarish shaped with 2 frames around, that is your Delaire face mask. Okay. Now this picture that you see here, that is your petite face mask. The difference is that they have just one single rod running from the forehead cap to your chin cup. Okay, so that is one single rod. So that's the difference between the petite face mask as well as the Delaire face mask. Okay, now one more image. What exactly is this instrument? It's actually quite clear in the image. If the image is just that single ring that is given, even then you should be able to identify what exactly is that image. Very good. It's a proximal stripping disc, okay, used for proximal stripping to create space. So it's a method of gaining space. So these are all the basic questions from ortho that could be included. Apart from that, you have your removable basic ones and your the other functional appliances like your activator, bionator. Those are very common ones. So I've not included them in the session. So just go through the images of activator, bionator, twin block. Okay, also there is something called as MARA, okay, mandibular anterior repositioning appliances, MARA, okay, and there is something called as forces appliance. So these are some appliances that you need to go through image, okay, and also maybe Frankel's appliance. So other than that, the most important pliers and the most important images from orthodontics have been included in the session, okay, right. So yeah, so I think with that we'll end today's session. Okay, fine. So all the very best to all of you. Okay, stay calm on the day of your exam because that is very important. Okay, don't lose your sleep. It's okay. So what you need to do is take rest. Okay, when I say take rest, don't close your books right now. Read properly, but have a good amount of sleep. Okay, and go with a fresh mind, okay, for the exam. Okay, so all the very best to all of you, right? So if you all want any more sessions on any other subject before your exam, do let me know. Okay, we'll have an oral surgery image based session tomorrow as well. Okay, because ortho and oral surgery are the ones wherein you get most of the images. Okay, sure. Bye bye.